TV, the Arena of Revival. And my name is Moses Mkare. I want to welcome you today to our topic, and we're going to discuss about health. And we as Christians in the Bible, we talk about that our bodies are the temple of the Lord. And I want to remind you that it's very important to be okay in our minds, the whole of our bodies, so that we can function well. And today, as we discuss this topic of health, in our studio, we're having two visitors. Thank you so much. Welcome so much our visitors to our studio today. I want to give you an opportunity so that I can say hi to our viewers so that they can know you. So welcome so much, Dr. Harry.
Thank you, Asante. Thank you very much, our viewers who are tuned to this good Siloam television. My name is Elias Kiambi. I work at Mitungo Hospital. I coordinate and instruct services there as the CEO and the founder, and I've been there for the last 20 plus years. I'm happy to be here, and I believe we shall have a productive and helpful discussion. Thank you.
Thank you so much. Karibu.
Thank you. My name is Paul Kimathi. I am a public health officer working with the Meru County government. And I'm also a member of board of Kenya Mental Health Board. I would wish to say that the mental illness is that mental instability or mental impairment. And this is a disease like any other disease, but unfortunately it has been taken so negatively, and most people have not been reacting to it in an appropriate way. We have heard even of the areas where the wants for those that are mentally ill are either situated near the mortuaries, or they are too tiny for the officers to be able to work there, and also the community as
ill. So, Dr. Karibu sana.
Thank you very much. As you may know, mental health is a wide subject, and I can assure you that we may not exhaust it with this short opportunity that we have today. But we shall make a good introduction, which will form as a platform from where we spring for continued discussions. There are several things that would cause mental illness. First and foremost, we begin with what is actually known and scientifically proven. There is nothing for sure that is by itself 100% known cause for any mental illness. So it's one of the illnesses where there is nothing that can stand out as a single cause of the mental illness. However, there are predisposing factors or fertile factors, or factors that make the ground fertile for the formation of a mental disorder. One of them is heredity. When you are born of parents that are mentally unstable, you stand the chances of developing mental illness. That is one. Number two, we have drugs, especially these hard drugs that are taken so that you feel high, you feel tipsy, and you feel happy and elated. As you keep taking them, they distort your mind, and eventually it will create a fertile ground for development of a mental illness. Then three, there are habits, social habits. Social habits begin simple and they begin small, but eventually they also mature into a full-blown mental illness. For example, drinking alcohol. Of course, the first few days after you begin drinking alcohol, nobody will realize that you have any mental problem. Or even chewing miraa, or even smoking bangi. The first few days nothing will happen and you are unlikely to get detected. But as you go on with the habit, the mental capacity will be distorted and challenged in a way that you start expressing yourself in ways that are known and seen to be abnormal. So we have habits, social habits. Then three, it's what and how we are brought up. You will realize and you will also accept and support that there are children who have been brought up in such harsh environments, such demanding environments, that for them to escape from those environments, they format a habit or habits for them to be able to conceal themselves in order to adopt those difficult situations. So needs also contribute into a formation of mental illness. For now, I think we can look at those, and my brother could contribute into others, because as I said, there are many.
Thank you, Daktari. There is also the case where we have environmental factors that involve an individual shortly before that individual is born, especially when the person who is taking drugs during pregnancy, this can be easily be an issue that is affecting the person who is not born. And then we also have issues of brain chemistry, where we have the neurons, the transmitters, the neurotransmitters, when they fail, and because of the impairment, then you find that the nerves, the nerves that are supposed to take the message, then they are not able to take that message. And then you find the situation where an individual cannot coordinate and may not even know the message is not being sent to the brain straight for action by the body. So you realize somebody can be somewhere because the neurotransmitters have been affected, then the nerves are not able to respond. And then when they are not able to respond, somebody can even put his hand in the fire, and then it gets burnt. And
they don't know.
They don't even realize it is happening. So those are some of the causes.
And to add,
Yes.
there are also industrial causes. For example, accidents. An accident that occurs to an individual that affects the head. One may end up getting epilepsy and eventually a mental illness that develops as a development process of that platform of epilepsy. Or just a frank, straightforward mental illness following head injury. Because of what Daktari here said, because those nerves are undisturbed, they are distorted, and they do not transmit the necessary messages the right way anymore, so that the individual feels what others don't feel, the individual sees what others don't see, the individual hears what others don't hear. Asante.
Thank you so much. So you've heard a lot, the causes of mental illness, and I'm sure you have known now. And I want to give you a challenge that, because these are medical terms you've heard here, and I know you're like, wow, what is this? So it is all about mental health. And I know as we proceed, you'll get to know more and more. And I'm sure we have a lot. So I want just to give them an opportunity also so that they can tell us. Now, because they've told us the causes of mental illness, what are these factors, the risk factors that they can cause someone or can make an individual to find themselves as in the position of being mental ill? What are these risk factors?
Thank you very much. Some of the risk factors are what we just mentioned as predisposing factors. But another risk factor which is coming up very clearly and very broadly today is what would be considered as youth habits. One of the biggest risk factors is actually company. We know from honest observation and experience that most of our students and children will learn about bang smoking and cigarette smoking when they join secondary school. That is where the habit is introduced to them as a virgin habit. And it begins small, as we stated earlier, but as it broadens with the time, it becomes a full-blown problem. Number two is what again we touched as a need, if we can call it so. You know, somebody who is in a difficult situation will want to make that situation rather comfortable for them to be able to live in it and within it. And this is very easily found in our population that lives in slum areas, where changa, for example, is the daily activity, drinking is the daily activity, fighting is the daily activity. So with the time, this child adopts these in order for them to also survive. Najua kuna msemo wa Kimeru unasema ukagendania na mukundu gakundu kana taju, kano gakundu kataju. It means when you adopt or when you are in the company of a wrongdoer, with the time you will adopt the same. Then number three, as I mentioned earlier, when the first time you get introduced to these drugs, and this includes alcohol, this includes cigarettes, this includes other hard drugs, heroin, and the like. The first few days, you feel very elated and you feel very happy. And momentarily, you are detached from realities. And because these realities are hard on you, they demand more responsibility than you can afford to offer, you tend to join and get into this drinking habit, smoking habit, and inhaling habit, so that you are able to adopt and continue in that environment, which would rather be hard for you if you actually remained normal. Thank you. My brother can contribute because I know he has a world of experience also.
We have traumatic experiences where some people are exposed to dangers. Say, for example, we have people like Kenya police who are working out there. The armed forces who have been working in the military, and they have been seeing killings, and there are people being killed and all that. So their experience is actually haunting them. Anytime they sleep, they are dreaming of what was happening out there in the field. And unless this individual is taken care of so that a healing process can be there, then definitely this individual, nobody will understand him. And this is why we are having so many cases in this country now. We are having the armed people resorting to killing the loved ones and all that, because they have not been given an opportunity to cure from what they have been seeing out there. It is important for the government actually to look at even the nurses. Sometimes we have accident that has claimed over 100 people, and this is a nurse who is taking care of these people that have been killed, that are maimed, that have injuries, and they have human feeling, of course. So it becomes very difficult for this individual. Unless we do something that will cure them, then definitely this can develop to illness, mental illness that can bring issues. Then we have the young ones who have been treated very badly, who have been beaten maybe at their early age. Every individual has got the memories, and most times those things appear like it is over, but it is in their subconscious mind. A child that has been treated so badly, maybe by the caretaker, beaten, learn without eating food, and you find that that individual, as they grow up, unless there is that hearing, then the moment they meet such a situation, then they remember. Their mind triggers to what is in their mind, which they had experienced early on. I want to give an example of a kid that right now is a big person, but then this person was mistreated by the in-laws and could not even be given food. To date, this person is a big lady who is married, but if you give her food, she can first of all ask, wow, is this mine? And you see, in our subconscious mind, there is something that is there that tells her, now this is not yours because of the early beginning. So these are some of the issues. And also we have the family, which have got a history of this mental illness. These are people that need to be taken care of because of avoidance of recurrence of the same. And you look at the situation that we are working in, you find that there are so many people that are overworking just to earn the money. But then you find they are working for almost round the clock, almost to 22 hours or even more. Others are in a position that they would not want anyone to sit in that seat, so they don't want to go on leave. They are working all the year round. The resultant is that apart from having mental issues, then also their output is too small. Their output is meager. So it is important that we look at what is really affecting our society so that we can be able to input and so that we can be able to prevent the issues of this mental illness.
Yeah, and I'm sure also these traumatic experiences can include also accidents and maybe experiencing your loved one's death, and because you are the only person who was there, it also affects your mind, and it also affects your behavior.
Yeah, it is actually broad. It even involves the aging people. Remember, the aging people, they have problems of forgetting. And sometimes other people may say that they are pretending. They are pretending not to know. Maybe it is a home scenario where somebody has hidden the keys for a store or for a house, and because of the aging beings, he or she has forgotten, and then the children, all other dependents are not kind to this individual, and then they say, anajifanya. You know, the moment those kind of ones come out, then these people will feel rejected, is like they are of no value, and this can contribute to a downtrend of this individual very fast because they feel like nobody wants them. It's just like a case where we have somebody who is fighting maybe the diseases like diabetic, for example, or some terminal illness diseases. And that person has now a feeling that I have really troubled these people for so long and I'm not getting healed. So I am of no use. You know, that kind of pity, self-pity when it comes up. And this individual can do nothing about it. Then it can easily bring an individual down, and finally we can have a mental case out of this case.
Perhaps to add just a little ounce of what Daktari is actually talking about, you know, something like suicide. You know, suicide is a result of feeling desperate, feeling useless, and feeling valueless. So you find no reason to live because nobody appreciates you, nobody recognizes you, and nobody behaves as if you are a present. And yet, we all want to be loved, we all want to be appreciated, and we all want to be felt. And we all wish that our presence would be felt in a much more positive manner. Thank you. Thank you very much.
Thank you so much, our two doctors. And I want to remind you that I'm sure at home there you are wondering, so what are these some of the things that you can see from someone who's mentally ill or mentally ill? Or what are these signs that you can see or you can notice from someone who is ill mentally and get to know what is happening? So I want us also to have it from with our doctors, get to know, okay, what are these signs that we can see? Because you know, sometimes we just see like Dr. Vanyamesema that you see an old man or old woman anasahau, you just say, anajifanya, you see. And we really don't know, maybe those are some of the signs that she's undergoing what? She's mentally ill. So I want us to just give us what are these signs that manifest from someone who is undergoing mental illness?
Thank you very much. Actually, we all know it's very easy to pick and detect somebody who is mentally ill. But universally, one of the most profound universal sign and symptom of any mental illness is lack of sleep. All mental illness victims fail to get nourishing and comforting sleep. That is one. Then two, depending on which direction your mental illness takes or has come from, you start neglecting yourself. That's why you see they don't take any bath, they don't shave their hair, they don't require any company. They neglect themselves because they feel they do not deserve to be friends to any. They don't deserve to dress. In any case, nobody will see them. Then three is where they feel people are their enemy. So they are violent towards them. So violence then becomes another profound sign of a violent person. Then three, or number four, they look at the property and look at your property as if you cheated them and the property should be theirs. Then the fifth or the sixth is where they refuse, fail, or do not look at things in their right perspective or prism. They will see objects that nobody else in that room sees. They will hear noises that nobody else hears. They feel smells that nobody else smells. This is what educationists or psychiatrists will call hallucinations. They feel sounds that do not exist or that are not heard by any other. Then, as they progress, they completely lose appetite. Actually, a mentally broken down person can die of hunger, can die of starvation, can die of dehydration, because they simply do not have that capacity to appreciate this need. Complete shutdown of capacity to appreciate what makes a human being. And then the fifth sign, or the sixth or the seventh perhaps, have not been counting, is where one tends to invite tendencies of committing suicide, just from what I mentioned earlier, because suicide is a sign of a mental illness. We all know that God gave us life as a precious gift. You have no right of interfering with it, but in this environment where you are mentally unwell, your capacity to reason that way doesn't simply exist. So you feel that you have no right or reason to live, and you do want to be absent or even kill yourself. You feel that your uselessness is so big that you had better be absent in this life. And very, very, very many other signs that we will go learning as we go on. Maybe daktari una zingine unaweza ongezea.
Thank you, Daktari. Perhaps the key thing to note when you are dealing with mental illness is that the one who is sick will never realize he or she is sick, and will talk like he or she is normal. And it is important that you are the people who know this individual for long, and that's why the treatment of such an individual depends so much on the relatives and the loved one who knows, I have lived with this man for years, for 40, or this lady for so many years, and this is the kind of behavior, this is how this individual behaves. All of a sudden you see a person who does not want to talk and has been a great talkative. Then ask yourself, why is this happening? Somebody who doesn't want to eat, or maybe somebody who has stress and would want to eat much more than this individual takes. So it is up to us, the people, the loved ones, the relatives, to note the differences that are happening in this individual, because he or she cannot be able to note the difference in her. There are so many people who their provocation is just there. If you just talk, they will just intercept, and they are angry about everything. So it is important that you note these characters and then report them. It is also important that from time to time, when you realize this is happening, then you are able to engage the medical professions who are able to talk to this individual and know where the problem is coming in. Because actually what you are seeing are just the symptoms. The cause of the whole thing you've not even known. No, yeah. So it is important that we be our friend's keeper, so that whenever we find somebody is behaving in a way that he does not behave kindly, seek medical advice.
Yes, adding on to what Daktari ametuelezea saa hizi, you know, somebody will break down mentally because the capacity to carry out a responsibility that is given them is simply not there. You know, mental illness is also the inability to carry out your responsibility as expected. So it becomes an escape route. That is why it is very important for parents, for caretakers, to realize and appreciate the capacity of our children, of our relatives, of our neighbors, etc., so that you give what they can actually adopt and carry and be responsible within. I know of a student who broke down because of being forced to take law when they didn't want it, or they felt they were not able to do it. So it is good that we avail responsibilities to people who are capable of carrying them out effectively and completely. Thank you.
Thank you so much, our two doctors. So like you've heard, there's a lot to our relatives that you're supposed to play part, or to our friends, because I'm sure like you've heard some of the manifestations or some of the signs that you may see from people who are affected mentally, is that you may not know, but the person you're living with may realize some of the signs, and that person can actually help so that they can get a medical professional who is going to help them to understand. There are our Dr. Elias here is a professional doctor, and it is good that if you have any person or any relative or anybody you know that has been undergoing these signs, his number is on our screen. You can pick it, call him, he'll respond, and I know you're going to get help from him. So before we conclude, I want just to give them a chance to say a few words, even as we conclude this program. I know there's a lot we're going to learn. We're just taking a short break, and I'm sure that next time we're going to have this topic again, we'll learn more about mental health. So thank you so much, Dr. You can just say something to our viewers.
Thank you. Thank you very much. The single biggest problem that we have regarding mental illness is the society. Now, you remember Daktari beginning it from there. The society doesn't look at mental illness as it were. They actually look at it in another way. They have an attitude that makes it very difficult and very unfavorable for these patients, because they are really patients. And there is even a line of specialty in medicine that takes care into putting them into care. They are patients. But the society looks at them as products of a curse, as products of having been bewitched because of wrongdoing of their parents or they themselves, as products of annoying God, and God wanted to punish them in that unique way. So my appeal is very simple. Let us take these patients, let's take them to health units, they will be assessed. Let's take them to churches, they will be prayed for, because of course some of the mental illnesses, as we said, the causes are many, and we have always worked hand in hand with the churches, with the hospitals, and it has always served us very, very well. The outcome has been extremely good. Thank you very much.
The key thing today for our viewers to note is that whenever you have somebody out there in your family who is behaving in an abnormal way, the way he or she does not behave, kindly take action immediately, because the best thing to do, the prevention for the mental illness, is early detection so that we can have early treatment. On top of that, we would also wish to tell the people that these people who did some things to the community and they went for treatment, we have an issue because they are not accepted back by the society, because they feel that this is a mandara, this one burnt their house, is arsonist, and all those names mentioned them. Some of the people have even raped and such the issues that really are not good to the community. However, we would call upon the people to welcome these people once they are able to be treated and rehabilitated, and now they want to be brought back to the community. It is important for the community to take them positively, because if they don't, then this case recurs again, and then they develop full-blown mental illness again. Thank you.
Thank you so much. We are coming to the end of our program today, and I want to talk to our viewers there. Whatever you have learned today, it is very helpful. And I want to tell you one thing is that, according to the scripture, faith without action, it cannot work. So put faith, but put action, so that now as you put action down, if you have any relative, the action will come is you pick that number that you see at the screen, call our Daktari, Dr. Elias, who can help you. If you have seen any abnormality or any behavior that you are seeing from a relative or friend that is not normal, or you can visit us here at Siloam, and you're going to get the same help that you might have obtained from our Daktari, and I'm sure you're going to help a relative, a friend, or a brother. Thank you so much for tuning in to our channel, Siloam TV, the Arena of Revival. My name is Moses Ngare. I am God. May God bless you so much. We'll meet again to some other point and discuss more about mental health. Thank you so much, and have a good time.
Thank you.